All doctors will be revalidated on a 5-yearly cycle. And that applies to trainees as much as it does to anybody else.
The revalidation process for trainees will take place as part of your ARCP panel, rather than at a separate appraisal, which poses questions for trainees about to take part in it.
I think the key question that I have is, how will the process actually work?
If a trainee doesn't do well in ARCP, will that affect the revalidation?
How will an individual trainee be revalidated, at what time point, and what documents do they need to present?
And could your performance in your ARCP affect your revalidation? Just 2 scenarios here.
The first one is a trainee who has done their exams but not able to do specific competencies. They lack those, to achieve those competencies. And second is a trainee who has done really well in the workplace-based assessments and achieving competencies, but they haven't passed their exams.
So let's get some answers.
The fact that the ARCP is being used as a surrogate for an appraisal shouldn't lead us to confuse the two processes. So the annual review of competence progression is that. It's about reviewing the progress of a trainee through their educational programme. That is in a way a separate process to the recommendation of a panel to the responsible officer about the recommendation they might make then to the GMC. So it's perfectly possible to get an outcome 2, so that's sort of where there are training needs that need to focus on in the next period of training, or indeed an outcome 3 where an additional period of training is being recommended, or in theory an outcome 4. Quite possible to have those going on in tandem with positive affirmations for revalidation purposes.
The ARCP panel for revalidation will actually not be any different to the ARCP panel that you meet with or that sits today. It'll have certainly a different role in the sense that it'll be collecting the enhanced information for your revalidation, but it'll still be making the same decisions about you, which is looking at the acquisition of your competencies and your progress and allowing you extra time, if that's necessary, for your development.
In addition to a changed ARCP process, revalidation will also require the completion of a slightly modified Form R, the registration form that doctors in postgraduate training submit to the deanery each year. The enhanced Form R includes additional statements about probity, health, complaints and compliments. And although most information will relate to the work in your role as a trainee, revalidation takes a broader look at what you do.
They might have been involved in some charity work, for instance, where they needed to have their registration with the GMC. They might have done a bit of locum work, which was outside of training. But whatever it is, they need to make sure that any relevant information that has arisen from those additional experiences as well as training is brought to the ARCP. In addition to that, any information relating to complaints or compliments or significant events that they were involved with or serious incidents that they were involved with.
We understand that being involved in a serious incident can be an inevitable consequence of working in the NHS. So I don't think trainees need to worry unduly about being involved in one. However, we do collect information from trusts when trainees are involved in incidents, and we also want to see what remedies and what the outcomes of any investigation locally is.
The ARCP panel will report to your responsible officer.
There are 3 recommendations that a responsible officer can make to the GMC, and they are a positive affirmation that the doctor is fit to practice, and we envisage that will be the vast majority of doctors in training programs. If the responsible officer believes that somebody isn't fit to practice, then that'll have been the subject of a separate fitness to practice process as currently exists. The second recommendation is one of deferment or deferral. And this may be because the doctor isn't available, perhaps they're overseas working in Australia, perhaps they're ill or indisposed through some other reason. And deferment of the recommendation can be made for up to 12 months in the first instance. And the third type of recommendation, which we think will be a very rare occurrence, is one of non-engagement, where the doctor concerned really hasn't engaged with the processes of appraisal that feed in to revalidation.
As well as being revalidated as part of the 5-year cycle, trainees are also assessed at CCT, regardless of when their previous revalidation took place.
It means they leave training with their revalidation clock set back to 0, so they then don't need to do another revalidation until 5 years further on through their established practice.
Revalidation for trainees will be assessed as part of your ARCP panel. It will include information on the enhanced Form R and will look at the broad scope of a trainee's work, including things like charity roles or work as a locum. It will take place every 5 years and again at CCT. More information can be found on the Deanery and the GMC websites.